Ladies and gentlemen, esteemed colleagues, and dedicated stakeholders, today I am here to discuss a vital piece of legislation that addresses a pressing issue within our healthcare system, the mental health and well-being of our healthcare providers. I propose the Dr. Lorna Breen Healthcare Provider Protection Act, which aims to create a supportive environment for our frontline workers, that they receive the resources they need to care for themselves while they care for others. The COVID-19 pandemic has illuminated a crisis that has long been simmering in our healthcare system. The alarming rates of burnout and mental health challenges among healthcare providers, according to a recent report by the American Medical Association, states that nearly 60% of physicians experience symptoms of burnout, leading to higher turnover rates, increased healthcare costs, and compromised patient care. It is essential that we recognize the financial implications of neglecting our providers' mental health. By implementing the Dr. Lorna Breen Healthcare Providers Protection Act, we would not only enhance the mental well-being of our healthcare providers, but also yield significant financial benefits for our healthcare system. By investing in mental health support programs, we can reduce burnout, which has been shown to lead to higher turnover rates and increased costs related to recruitment and training of new staff. A study published in the Journal of Healthcare Management highlights that organizations with robust mental health programs can save between $4,000 to $10,000 per employee annually by reducing turnover and absenteeism, ultimately leading to improved patient care and lower operational costs. The investments would create a more sustainable healthcare workforce, thereby lowering the overall financial burden on healthcare systems while improving patient outcomes. By implementing the Dr. Lorna Breen Healthcare Provider Protection Act, involves both initial and ongoing costs, primarily associated with establishing comprehensive mental health support programs for healthcare providers. According to estimates, creating and maintaining these programs could cost between $10 million and $20 million annually at the federal level. This was published by the U.S. Department of Health in 2022. This funding would support mental health training, resources, and services across healthcare facilities nationwide. However, these costs should be viewed in the context of potential savings, which I referenced above, by reducing burnout and turnover rates. Hospitals can save significantly on recruitment and training expenses, which can exceed over $100,000 for each nurse or physician replaced. Thus, while upfront costs may seem substantial, the long-term financial benefits of a healthier, more stable workforce could further outweigh the initial investment. I have some proposed funding solutions. Number one could be federal grants for mental health initiatives. The Dr. Lorna Breen Act proposes to increase federal funding specifically for mental health programs aimed at healthcare providers. This funding could be reallocated from existing health initiatives that have proven less effective, and we could direct the resources to where they are most needed. Number two, partnership with healthcare institutions. We will encourage hospital and healthcare organizations to invest in comprehensive mental health support programs for their staff. For example, a commitment from a hospital to allocate a percentage of their operating budget to mental health resources could significantly reduce burnout and improve retention rates. Three, CMS incentives for mental health programs. We can create an incentive structure within the Centers for Medicare and Medicaid Services where healthcare organizations that implement effective mental health programs for their staff receive increased reimbursement rates. This approach not only alleviates the financial burden of implementing such programs, but also encourages hospitals to prioritize their employees' well-being. I understand that some may have concerns about funding and sustainability. However, research shows that investing in mental health resources for healthcare providers yields substantial returns. A study published in the Journal of Occupational Health Psychology demonstrated that organizations with robust mental health programs experience lower turnover rates and improve patient outcomes, ultimately saving money in recruitment and training costs. In conclusion, the Dr. Lorna Breen Healthcare Provider Act, Protection Act represents a critical step towards safeguarding our healthcare providers' mental health by reallocating federal grants, fostering partnerships with healthcare institutions, and introducing CMS incentives. We can create a supportive environment that empowers our providers to deliver the highest quality of care. Let us unite in support of this essential legislation, ensuring our healthcare heroes have the resources that they need to thrive. Together, we can make a difference. Thank you for your time, and I look forward to your support in bringing the initiative to life. Thank you.